Hello, and welcome to Dr. Greg and Monica's Lifestyle Solutions. This time it's briefs on health and conditions. And what we're going to be discussing over the next few minutes are sinus headaches versus regular headaches. What are some of the differences? I know that you see that a lot with your patients.
No, it's true. Headaches, they come in all kinds of varieties, as we all know. But some of the major things, actually, can I use you to demonstrate?
Please do.
Well, thank you very much. Okay. There's different kinds of headaches, and the whole thing is on the pattern, on where the head hurts. Okay. One of the most common, actually, is up here, something along the front, sometimes in the cheeks, sometimes above the eyes. But what we're dealing with, there's several different kinds. Like if the headache is up just in this area, several possibilities. One is eye strain. Sometimes it's just the glasses staring at the computer screen too much. Sometimes outside of that, it's the focus, the kind of concentration. Other times, usually if it's a throbbing, kind of painful, unrelenting pressure with a bit of throb in there too, a lot of times it's a sinus headache as well. But sometimes we get the sinus pressure in the cheeks, likewise. So you know that because it hurts, because sometimes you feel like you might have a runny nose, or you might not because it's all clogged up. But the main thing, we call it the facial mask. There'll be ache, pain, or pressure in the facial mask, but then depending how you treat it, it's depending on what kind of a headache and exactly what we do about it.
How can you figure out, obviously there is, an illness component to it for some of them, but also it could be a nutritional component to others. What might bring on one versus another as well?
Well, the sinus headache, of course, it could be allergy, in which case there may be no other symptom other than the pressure. Sometimes, though, allergy, there's usually that bit of inflammation, the drainage down the throat, or in the nose, or the itching, watery eyes. Of course, that's harder to find out if you've actually got a bug. Then you have to watch out for the fever, possible chills, or any of those extra aches and pains in there too. But that's one way to figure, is it only symptoms you have, or are there other things associated with it? And if you've got no symptoms whatsoever other than the pressure, then it's time to check your glasses and just relax your forehead.
Does one last longer than another? And for example, there are many times when it's at that time of the month, for us women, we might get headaches beforehand along with other symptoms, backache and cramps and things like that. But there are many different other conditions that you might get a headache signaling that something is wrong as well.
It tends to be a different pattern of headache.
Okay.
The ones that go in the monthly cycle, it's another topic, but those can be the side of the head, a migraine, sometimes around the whole head, sometimes the base. But in my experience in treating people, they don't usually complain so much about the frontal headache.
Are there any home remedies other than taking aspirin, ibuprofen, those kinds of things?
There's a few.
Okay.
There's a few. One, my go-to, of course, is the acupressure points, which you can do yourself. Several of the key ones, right here, just on the sides of the nose.
Okay.
Just in these little wrinkles, you push in and up. There's a couple of nerves that exit there, but if you have a bit of sinus pressure, those can be pretty sore. But if you rub, kind of push in and up, a bit of discomfort, depends on the person, 20 seconds to 2 minutes, depending. That can ease pressure. Then right above the eyebrows too, just above, if you feel right about halfway, pretty much, there's a little groove, a little notch. I'm on it right now on you. And if you, again, in and up, if you rub here, that's another very good acupuncture point that can relieve it. Other than that, you can use, believe it or not, if things are clogged, something spicy like mustard to open up the sinuses. You can use a salt infusion, which, kind of a nasal neti pot. When you irrigate, actually, infusion in the right words, the irrigation is what you want to do.
I'm going to interrupt you right there. If you're talking about those sinus headaches, then too, if you're talking about just being able to breathe better.
Humidity, the nebulizer.
Well, and peppermint oils, essential oils. Oh my goodness. I use it in the mornings anyway, just putting actually a drop of peppermint oil into my green tea in the morning and taking that big whiff. Not only does it help wake me up, but it also really clears any kind of congestion or anything that I might have.
Well, it's very timely because wintertime, springtime, fall, basically when it's either cold season or allergy season, that's the most common time for sinus headaches. Then you've got kind of another clue too. If you're getting that kind of a headache and it's not any of those seasons, more likely possibly to be frontal tension or the eye strength like that.
Are those sinus headaches something that acupuncture can do anything for, or certain, like you said, you'll manipulate a certain amount that one can do at home as well, but if it gets really bad, what can you do or can a doctor do in a clinic or for example, over here for those
The
patients?
acupuncture point, that's a first choice for that kind of a headache. I mean, for even muscle tension on the forehead, that's a really common one. The stress headache. But if it fixes one type of headache, it probably works with several others as well, because it's a similar array of points that can help this. And acupressure, yeah, it's acupressure, but originally those points came from acupuncture, but then if you massage them cleverly, you get a good benefit too.
Okay, so there you have it. Sinus headaches versus regular headaches. Which one do you have? Or is there a different one and one that you want to talk about a little bit more? We'll be happy to address those in one of our other segments, Dr. Greg and Monica's Lifestyle Solutions, this one on health and conditions. See you next time.
Next time.